it's me. I'm filming this because I know it's been a long time since I've posted, and I thought I would just sort of, fill you in a little bit. When I first created this video blog, it was mostly to track my progress after bariatric surgery and to, go through that process. And while that's still sort of one of the points of this, it's also going to become about my ongoing health issues. I had bariatric surgery, specifically the duodenal switch, because my health was out of control. I was 37 and I was an uncontrolled diabetic, and I had severe hypertension, chronic full body pain from osteoarthritis from carrying around the equivalent of 2 extra people, and I had developed neuropathy in both of my big toes. So I made this choice to have this surgery, and I was very successful. I felt fantastic for like a year and a half. I struggled with no carbs, and so I would compromise and give myself one night a month or something where I didn't care. I struggled with the fat dumping, if you will. It's not sugar that bothers me, but it would be the fats. I tried so hard to stay away from fat, but if some snuck in, I'd be ridiculously sick. But having said that, I never regretted it, and I guess I still don't. About a year and a half after surgery, I began to develop this strange sensation. I would almost feel like I was going to pass out. I started out by calling it vertigo, because I never had vertigo. I didn't know. And then later, when I was trying to describe it to a doctor, they told me, well, that's not vertigo. Because when you have vertigo, it's like you're stationary, but the world is spinning around you. So then I amended it to dizziness or lightheadedness. I was simply told I had Meniere's disease, which, if any of you have that or know what it is, it's basically like, hey, you get dizzy. You don't know why. Here, have these pills. And they prescribed me meclizine, which actually did jack and shit. And so, it would get to the point where I would turn my head and I'd kind of keep going and fall out of the chair. So I finally, because I have a seizure disorder, I went to see my neurologist, and I told him what was going on. He was like, well, again, it doesn't sound like vertigo, but I can send you to an ear, nose, and throat guy. It kind of just sounds like you have just random dizziness. Maybe he could check to see if you have something going on in your inner ear. Saw the ENT. My ear canals were clear. My sinuses were, normal. Throat was normal. I've been thinking about normal. They wanted to do a VNG study, which is a study to try to cause vertigo. But since I wasn't technically having vertigo, I really didn't see the point in putting myself through that test. Fast forward to 6 or 7 months, and it was subsiding. I started having what I thought were panic attacks, and maybe they were, I don't know. My cardiologist says that I have benign cardiac skip beats, so basically that's just my heart wanting to throw in an extra beat now and then, and it's very irritating. It's very scary, and because my dad had such horrific heart problems, every time I have one, I kind of panic. So it's cardiac skip beat, panic attack, causes more palpitations, and it's this cycle. Well, it was becoming debilitating. At the end of last year, I had foot surgery, and symptoms seemed to subside. Albeit briefly, symptoms did subside. But I began to notice that after I came back from the leave and went back to work, I was gaining a ton of weight. And my depression skyrocketed, and I went to all-time lows, and I began binge eating, and I recognized this. And the more weight I gained, the more depressed I got. Sorry, I keep having to pause because I had someone in using the bathroom. But I just kept gaining this weight. And I went to my psychiatrist, and I'm like, hey, here's my situation. They increased my antidepressant, increased my own anxiety medication. But with the increase in my antidepressant, I kind of felt like the anxiety went away, but they told me there was nothing they could do about my binge eating. Well, I was, I don't know, maybe back in June, maybe July, I'd gone to the gym, and is my routine in the morning after the gym, I'd get my next cup of coffee and I'd come in my bedroom to harass Lee before he goes to work. I got halfway through my bedroom door and all of a sudden the world began to spin. And I knew that I kind of collapsed against the door frame because I knew if I moved, I was going to faint. And so I told Lee, you gotta help me take my coffee, and you gotta get me to the bed. So I sat on the bed, and it kept spinning faster and faster, and the nausea was coming faster and faster. And I kind of experienced a little bit of this the last time my blood pressure peaked, way before, so when I was still married. I mean, this was back in 2010, 11 maybe. And so I had him grab my monitor because I have a blood pressure cuff here. And sure enough, my blood pressure was like 140 over like 101. It was ridiculously high. And so I managed to calm down long enough to get the vertigo to stop. I had Lee dig in my medicine drawer because I had been given a Tylenol for my palpitations. I never took it because my blood pressure was super low, but now it was super high. I no longer had it. So I called my then primary care doctor, who told me that my blood pressure was not high enough to create my vertigo. That was the only thing that was different. So I messaged my cardiologist, who agreed. So I began monitoring my blood pressure at home. And it consistently, the bottom number did go down into the mid-90s, but the top number stayed about between 140 and 150. It was not coming down. To put this into perspective, I was working out, I still am, except this week I've been sick, but 5 days a week, an hour and a half at a time at the gym every week. Running on the treadmill, walking on the treadmill, doing weights, just kicking my own ass at the gym. My blood pressure is high, and I'm gaining weight. I changed primary care physicians, and she agreed that my blood pressure was too high, and gave me a Tylenol, 25 milligrams in the morning. I then went to my cardiologist, who agreed, okay, it's still high, because at that point I'd been on the Tylenol for 3 weeks, and it was still high. So he doubled it. So I was now taking 25 in the morning, 25 at night. Blood pressure is normalized to a point. It still runs smidgen high, which it never has before on Tylenol. And then I went back for a follow-up to my primary care doctor, and in the span between when I saw her the first time and the second time, my health spiraled. I've in the beginning, after my surgery, I struggled with chronic diarrhea. And I had this problem before my surgery because I had IBS. In the beginning, I had more trouble with constipation than anything else. If I inadvertently ate something fatty, okay, then I'm gonna have a problem. I haven't been constipated in 2 years. I'm on the flip side of that. And in that month between my first visit with the new primary and the follow-up, I had not 1, not 2, but 4 separate incidences of bowel incontinence. Fortunately, I was at home. I was just standing there, I was outside doing my thing, and I kind of felt a pressure. Okay, well, I probably time I had to go, so I went in. I couldn't even get turned around to come in the house, and it was just like, hey, yo, click. This is not okay. Not okay at all. I mean, what if I had been at work? What if I had been, I don't know, somewhere where I had no access to a bathroom? This is going to seriously impact my life. So I made this list because in addition to this intestinal issue that I've been having, I finally figured out a way to describe that weird lightheaded sensation I was getting that I had previously called vertigo, then I was told dizziness, lightheaded. Currently, my dryer is plugged into my garage. When I put a load in and I push the start button, all the lights in the garage dim. Within a second, they all come back up super bright and they go back to baseline. So it's kind of a power drain, power surge. That's kind of like what I am experiencing. It's like my body is shutting down and then, oh, can't do that, go back up again. And it's this constant down, up. And it just cycles this way. And if I try to walk, if I try to get up and down, it doesn't. I don't care if I'm laying down, standing up, sitting on my head, you know, dancing a jig. It does it. And it's not just in my head, it's in my extremities, it's in my legs. I feel this pulsing sensation all over me. So I brought that up at the follow-up. To my utter horror. Now, I have been very careful about not binge eating. Very careful. I can't not do starch currently, because if I don't do starch, my sugar takes. And I feel really crappy, and I'm starving, and it doesn't work. I don't have any energy. So I'm trying very hard not to binge eat. And so I shouldn't, and as much as I'm working out every day, I should not be gaining weight. In that month time between the initial and the follow-up, I gained 7 pounds. If you look at my body, you look at my face, I am puffy. It's not just fat. I'm retaining water. By the end of the day, I can't get my rings off. By the end of the day, you know, my fingers and toes look like sausages. I started to discover I'm developing bruises, and I don't know where they're from. When I have this pulsing sensation, my muscles are so weak and hurt so bad, and I can barely put one foot in front of another. I have to kind of lean on one of the therapists at work has severe chronic pain and has lupus and has all these things, and she says, when I'm feeling that way, I kind of tend to like just run my knuckle over the wall as I'm walking, and it kind of keeps me upright and keeps me from, you know, kind of losing my sense of direction. So I have to do that. Now my blood pressure has stayed high. It was all, and I told her about the diarrhea and the issues, and so she ran a series of blood work, including additional thyroid studies that they don't usually do. Now, I have a multinodular goiter. It doesn't affect my thyroid function, or at least it never has. I've had multiple ultrasounds. I went in for a needle biopsy, and they decided they didn't need to do it because it looked normal. So I've never had my T4 and my T3 tested. I've only ever had the TSH, which is the hormone that causes your thyroid to release the hormone. So my T4 was fine. My T3 was 1 point low, which I've never had it tested, so I don't know if it's normally that low. So she also ran what is called an ANA panel. I don't remember the whole name for it, but it's the generic preliminary test they run for autoimmune disorders. So I went to talk to Sandy, who is one of our therapists at work, and I kind of like was explaining what's going on with me. And she, not that day I wasn't wearing any makeup, and so she was, you know, come close, I want to look at your face. And she goes, it's not too much there, but I do see it. I'm like, see what? Well, apparently if you have lupus, you have what's known as a lupus butterfly in it. It's a rash demarcation line that runs through your cheeks, over your nose, and down here. I have it. It's light. It's not red. It's brown, but it is raised, particularly across the bridge of my nose. I just thought it was all acne and freckles. Right now, we don't have a diagnosis of anything. The doctor ran some more tests. She also, in that first panel of tests, ordered stool samples, which is traumatizing in and of itself. If you have never had to do a home stool sample, let me tell you, traumatizing. If any of you know what a nun's catch is or a hat, these white contraptions are put in a toilet so you can pee in them for people who have difficulty doing a clean catch urine test. They pee in it and you just pour the stuff in the cup. Well, they give it to you as well, I guess, for these tests. So you have to poop in this hat. And then they give you this little container that has little, they call it, the girl who gave it to me said called it the pooper scooper. And you pick it up and you use this scoop to pick up feces and stick it in the container until it gets to the black line. Then you close it and you shake it. And then I had 2 more vials. These had Q-tips. And so I had to open it, take it out, swirl it around the sample, stick it in there, and make sure it didn't go over the black line. Okay. 1, gross. That's why I'm not in the medical field. I can't stand feces. 2, that was so traumatizing to me because then, after I had it all done, then I had to figure out what I'm going to do with this shit in a plastic container. Long story short, everything they tested for Shiva toxin, they tested for C. diff, they tested for parasites, they tested Giardia, they tested for everything. It all came back negative. I do not have a viral or bacterial reason that I am having this diarrhea incontinence issues. To be fair, it has subsided to a point. I mean, I'm still having diarrhea. I'm still going anywhere from 4 to 5 times a day. My record for this whole thing has been 13 times I have pooped in one day. And that's, I don't even have to have anything on my stomach. Like I have not even had my coffee yet, and I'm in there blowing up the bathroom. And it is, it's horrible. It's debilitating. So she ran this next series of tests. Most of them came back negative again, including the RA factor. I know I don't have the RA factor. I have been tested for it before. This is for rheumatoid arthritis. I know I don't have it, but I'm not even close to having it. 2 of the tests did come back positive, one of which is one she didn't order. Apparently, once you have diabetes, you're always diabetic. It just depends on if you're in remission or not. For me, I'm in remission, but I still have to have all the periodic diabetic tests, including the microalbumin panel. Normal is less than 20. And that's protein. It measures protein in your urine to test how your kidneys are functioning. Ladies and gentlemen, I am at almost 100. I have never had kidney damage ever before, and I began to think, I'm not urinating like I was. I go to the gym. I have a cup of coffee before I go, a 32-ounce bottle of water, another cup of coffee, probably another cup of coffee. I'm drinking fluid all day. I drink anywhere between 70 and 96 ounces of fluid a day, and I am not urinating like I was, and it's dark, and I've got recurrent back pain again. I haven't had back pain in years. So, okay. The thyroid, one of the thyroid tests came back fine, normal. The thyroglobulin test, this is an antibody test that kind of looks for antibodies that are attacking the thyroid. Normal is anywhere from 2 to 35. I am at 268. Now, I don't know what any of this means. What we do know is there's some sort of anti-immune disorder going on, something. She's referring me over to a endocrinologist. I already have one who has been following my goiter as well as my diabetes that I had. So now I just messaged her to see if I can get in with her to find out what the heck is going on, because honestly, at this point, I'm terrified. Could it be lupus? I don't know. At this point, we know that my thyroid is being attacked from within. That is likely the reason for my weight gain. That is my kidneys problem is definitely the reason for my water retention. Because, ladies and gentlemen, my lowest that I was at, and I was so proud of this, I was at 174. That was the lowest I've ever been that I can remember. When I weighed at the doctor, I was 259. Let that sink in a minute. Yeah, okay. The end of last year, I was over 200 pounds again. I was fine. I was like 210. No big deal. I am at 259 pounds. Yes, I'm still over 100 pounds less than what I was when I started. I don't have collarbones anymore, ladies. I don't have cheekbones anymore, gentlemen. I am starting to see the fat me reemerge again. This is not okay. I did not put myself through this to have this happen. Regardless of what the diagnosis is, I just want a diagnosis. I want to know what's wrong with me. Throughout all of this, my skip beats have gotten worse, and so Dr. Muradkin, my cardiologist, has ordered a halter. I wore it last week, turned it in. I'm waiting for those results. Short of a cancer diagnosis, because none of us want a cancer diagnosis, I want a diagnosis just so I know what's wrong and how to treat it. So that's going forward what this is going to be about. The blog will still be life after duodenal switch surgery, but it's going to be chronicling my current health issues, of which there are a lot. I know a lot of people who have post-bariatric surgery had health issues arise, health issues they didn't have before. All of them? No. Majority of bariatric surgery patients that I know have had perfect lives, have had nothing, not perfect, we know, but obviously no additional health problems arise. Maybe the diabetes comes back, maybe, whatever. But they don't have something life-altering, which is what it appears I am having. I will keep you apprised of what it is as we go along this process. And I will keep you apprised of therapy and such. We are going to Oahu Vacation starts in exactly 10 days. Do a little happy dance. So that'll be good to get away. But I'm trying to see the endocrinologist before we go, so I can at least get something going on. But I'll keep you apprised. I'm headed off. I have to go start dinner. So be well, and post any questions you have in the comments. And if any of you have had problems with like this after bariatric surgery, let me know. I kind of want to know what to expect, if this is kind of normal. I was considering re-sleeving, but if the weight gain is because of an autoimmune thing, the re-sleeving is not going to help. So, all right, bye.